Once again, we continue on with conversations here in Morning at NTV. I am Priscilla Regina Naloka. You can stream live with us on YouTube as well as Facebook, but hashtag Morning at NTV on Twitter can give you all the information of the discussions that we've had so far. However, these discussions do continue. When I was growing up, one of the things that was so eminent, especially when it comes to my immunization, is tuberculosis being one of the 6 killer diseases. Unfortunately for us, even with the evolution in medicines and treatments, it's still regarded as a serious killer disease. And interesting to note that it now is even a more killer disease than HIV and malaria for that matter. But each year, at the end of the day, we get to still recognize World Tuberculosis Day, and this comes around every March 24th, which is in 4 days. Now, this annual event commemorates the death in 1882, when you did have Dr. Robert Koch announcing his discovery of this tuberculosis and the causes of tuberculosis. World Tuberculosis Day is a day to educate the public about the impact of TB around the world, but more so here in Uganda. This morning I am joined by Evangelist Roger Paul Ramshanju, member of the World Health Organization Global Civil Society Task Force on TB, and you're most welcome. It's a pleasure to have you. And I know that you have had this disease yourself at some point.
Yes, directly affected.
Yeah, directly affected. Yeah. Okay, you'll be sharing with us that story a little bit later. We also do have Dr. Isiko, who's also Paul, Executive Director, Uganda Stop TB Partnership, here to give us more information on this TB. You're most welcome, Doctor.
Thank you.
Okay.
Thank you, viewers. Nice to be here.
So while I do have 2 polls on set this morning, just picking up with the evangelist here, in regards to your relation with TB and how close it came into your household and the impact it has had on you.
Yeah, thank you, Priscilla. TB, in fact, came to my household. I got my wife succumbing to HIV, and then she was diagnosed with TB. At the time, stigma was so high, and the pill burden was high. I remember when my wife was given the first tablets, that's when I knew that my sweetheart won't live long, because I said about 4 tablets at the time in a day. And then she had already had a complication of the 9 months of pregnancy. She was sick. So stigma was high, and that was the experience of HIV, because she was diagnosed with HIV, then with TB again. So I found the liver infection, so she could not deal with both situations. So she had to finally succumb to that, because she was growing weak and weak every day after 9 months of pregnancy. So she succumbed to HIV. Then, of course, gave birth to our firstborn, also was born with HIV. Then second, also born with HIV, a boy who followed the mother shortly. I remained with my daughter living with HIV. So that's my experience. So so my daughter got TB at the age of 9. At the time, I looked after her, and I called it VIP treatment. I gave her VIP treatment. She got cured of TB. She's now living. And
so when it comes to the burden of TB in Uganda, what's the burden of TB and leprosy in Uganda?
The burden of TB, as you might have heard, TB is still a burden. It's a burden when 30 people die of TB every day. That's a coaster. Bus, it's a coaster, full coaster dying every day. It's not it's a big burden. And another trigger of that burden is ignorance about the disease. People still think it's witchcraft. People still think the myth about the disease, they still think witchcraft. And because of stigma, people don't want to accept that treatment is available and free at every public facility, because of stigma.
Okay.
Stigma and ignorance. Yeah.
With stigma and ignorance, we also want to understand TB and leprosy somehow walk hand in hand. Doctor, could you elaborate to us as to why these two actually walk hand in hand? What's the correlation?
Yes, thank you for that question. TB and HIV, working hand in hand. You know what HIV does to the body? It breaks down your immune system. And TB is a highly opportunistic organism. So it will take advantage of your broken down immunity to be able to now opportunistically take over the body. To be, it now thrives, grows very fast in this weakened immunity because there is no defense mechanism. So you find that many patients that we have tuberculosis or HIV, those who have HIV can easily contract tuberculosis because of their weakened immunity. So they can easily get infection from, I mean, the bacteria, the germ is airborne, so it can easily be passed on. But even without that, many people have TB which is silent in their bodies. So when your immunity is broken down, this now germ can easily come up, flourish, which was silent, and then
and we saw the relationship between it and COVID-19 equally.
Yeah, the relationship, of course, with the COVID, they are all affecting the lungs mainly, and the tuberculosis spread mainly by through really it's airborne, and then we know very well that COVID is also droplet, and they affected the lungs, and so that's the relationship. So, and then even somebody who has tuberculosis can easily suffer more consequences of COVID than a person who doesn't have. So that is the problem.
Okay. All right. As we get to celebrate World Tuberculosis Day on the 24th of March, Evangelist, I know that so many strides have taken place in the fight against tuberculosis being a killer disease. Could you highlight for us those strides that have been successful in the fight against tuberculosis? But also, we still have a long way to go. What is the journey that is beholding us?
Yeah, thank you, Priscilla. I think we have made strides, good leaps in the fight against TB. One, with awareness, we've tried now. Uganda is able to through advocacy, the Uganda Stop TB Partnership, where Dr. Paul is the executive director. They've done a great job with parliamentarians. You know, with TB, there are two things, about three. One, awareness. Two, we need commitment of resources by government to make sure we can end TB, the budget of TB, parliament to be increased. Three, is to ensure that we reach the grassroots, household level with that awareness and create demand for people to be able to come voluntarily for testing and being screened for TB. So to get back to your question, is like we have done strides because when Uganda Stop TB works with Parliament, we are able to move our budget, the component of TB in the health budget from I think around 3% to almost 7%. So that was a very, very good side, and we are still moving. And you realize that we have worked so hard. Before it was even worse, but today, remember last year we had a very good national stakeholders conference in Munyonyo that brought so many people. So the leaders, we've had a multi-sector approach of the WHO, bringing everybody on board, leaving no one behind. We have had all agencies of government, ministries participating, even in the National Strategic Plan of TB. So there is a lot of strides are being made to make sure everybody, no one is left behind, in order to achieve universal health coverage and then sustainable development goals. Okay. So we have done a great job in that line of awareness. We have moved, and we hope we are going to move and end TB by 2030.
2030.
It's not easy, but
Well, that's going to take the mitigation of, you know, elements like Uganda Stop TB partnership. However, between when you initiated and 2030 projected, what are the challenges in there that you're being faced with mitigation in dealing with TB?
Yeah, the biggest challenge as of now is that there appears to be low awareness about tuberculosis in the general community. You know, once the community is aware, they can easily be able to seek care and services, and which services are actually everywhere around the whole country, which are free at all the government health facilities and some of the accredited private facilities. And then the other challenge that we find is that people with tuberculosis are quite stigmatized, this double stigma. So you find that TB itself is stigmatizing, but the knowledge by people knowing that many patients that suffer from tuberculosis may have HIV, and HIV is another stigmatizing disease, they tend to hold back. So we need to create a lot of awareness, and that's the main reason of our TB Day, because this is an ancient disease, over 130 years since it was discovered by Koch. Actually, but then the awareness is still, and that's why we need to keep also drumming so that people are aware that this is a disease that is curable. And once you take your medication well, you adhere to your treatment, you'll definitely cure. So, and because of some lapses of
you have mentioned treatment, and
yes.
Of course one of the challenges was treatment in your case. Has that treatment improved in terms of how much is taken in?
Yeah, treatment has been improving, very much so. And well, for example, now that I'll just give an example of one area of improvement is that we've, as of now, for tuberculosis, that the ordinary, if I can call it, which we call the drug susceptible, TB that is sensitive to treatment or to the ordinary treatment, the drugs we give are basically now by mouth. We are no longer giving the injectables. And after 6 months, you really cure. And for the drug resistant, the TB that is resistant to the use of drugs, previously we were giving treatment for up to 2 years. But of late, and we are starting with injectables, but now we have even removed the injectables. Okay. We are giving completely oral treatment, and even the period, the duration has been reduced.
Mr. Ramshanju, in regards to treatment, at the end of the day, it comes at a cost, accessibility and availability. Where do we stand right now in regards to those three in Uganda?
The accessibility, availability is made possible by the Global Fund. The Global Fund to fight AIDS, TB and malaria. They have been supportive to all globally. And that has enabled people to access treatment. And of course, affordability does not apply in this case because this treatment is free. In all public facilities, treatment is free. And maybe to add, because of stigma, some people still go to private facilities and pay for TB because they don't want to be identified as TB. But so far with treatment, in all public facilities, it's free of charge. Okay.
Yeah. Closing remarks as we look forward to commemorating World Tuberculosis Day.
Closing remarks is that from the civil society, of course, I'm saying civil society and communities must work with government. There should be meaningful engagement of civil society working with government in order to really end TB by 2030, because they are the custodians in the community, the civil society and community, affected communities, to be able to create demand and people come to facilities to test for TB. So that linkage and engagement should be emphasized and also people to be aware of prevention of TB. Open windows when you're in a taxi or public bus, or open windows. When you're coughing, be careful. Just cough, put a handkerchief or use your hand to cover your nose. Don't cough carelessly. And to know that TB is curable. Treatment is free of charge in all public facilities. I urge people with symptoms of TB, when you get night sweats, you get a cough more than 3 weeks, you loss of appetite, and when you get such symptoms, go the next public facility and test for TB.
Okay, all right. Dr. Isiko.
Yeah, thank you, Priscilla, and the viewers. We have World TB Day coming on 24th March. The World TB Day national commemoration is going to be held at Butaleja, Goma grounds, and everything is set up. But with the whole of this March, we are really having heightened activities for tuberculosis, from prevention, diagnosis to treatment. And just actually last week on Friday in Mukono, we launched the World TB Day at Namawojolo. We have our mobile vans that are going around. We are screening patients and giving them the services that are available. So you are all welcome to Butaleja for World TB Day national event. The guest of honor is gonna be the Honorable Prime Minister, Right Honorable Robin Anabanja.
Okay. All right, thank you so much, Dr. Paul Isiko, and also Evangelist Roger Paul Ramshanjil, for enlightening us more on World Tuberculosis Day. At the end of the day, it requires committed resources in order for us as a whole to fight against TB. But the good news is that as far as public health facilities are concerned, there's free screening, there's free diagnosis, and free treatment. If you know someone, or if you are that someone, please go and get this service for free, because at the end of the day, the promise is it's curable if detected early. That brings us to the end of this conversation. We take a short breather. We return shortly. Stay with us.